Aloha, everybody, and welcome to another edition of the Weekly Dose. I'm Brooks Baer for the Hawaii State Department of Health. Very much appreciate you guys checking us out again this week on the Weekly Dose. And today's topic, very serious topic, variants, COVID-19 variants that are spreading throughout the islands. It's great to be informed. It's kind of frightening. We're going to hear from an expert on this. The administrator of the Hawaii State Laboratories Division, Ed Desmond, will be here with us in just a few minutes to talk about that. But first, I want to bring you up to date on the vaccination effort. Coming Monday, the 12th of April, the Department of Health will be expanding vaccine eligibility on the island of Oahu to everyone who is 50 and older. So if you are in one of those essential worker categories or you are age 50 and up, come Monday, April 12th, you'll be eligible to register for a COVID-19 vaccine, and we certainly hope that everybody takes the opportunity to do that. In fact, if you are currently eligible, you probably want to take advantage of the opportunity to register for a vaccine as soon as you possibly can, because on Monday, the following Monday, the 19th of April, eligibility will be expanded to everyone who is age 16 and older. That means a whole lot more people are going to be clamoring for those vaccine appointments. And so if you got a chance now, please get in while the getting is good. And here's a tip for you. Go to hawaiicovid19.com. Look in the upper right-hand corner of hawaiicovid19.com. There's a button that says registration. Go there and look for a vaccine opportunity at one of the local pharmacies. The pharmacies, through the federal retail pharmacy program, have been getting more and more doses, and they have open appointments. Not all the time, but they often have open appointments. And so if I were vaccination shopping, I would go there under hawaiicovid19.com, click the registration page, and check out the pharmacies. There is a catch-all category for the pharmacies. It's called Vaccine Finder, and there is a link for that on the website I've just told you about. So vaccination opportunities expanding to 50 and older on Monday, April 12th, and then to everyone 16 and older on Monday, April 19th. And of course, the neighbor islands are already vaccinating people who are age 16 and older. All right, having gotten that business out of the way, it is my pleasure, everybody, to introduce to you the administrator of the State Laboratories Division, Dr. Ed Desmond. Ed, thank you so much for taking the time.
No, thanks for having me.
A couple months ago, us lay people, we didn't know much about variants or mutants. I thought it was just a movie. Ever since then, I've become much more frightened of mutants because they're very real, these COVID-19 mutants. Maybe just kind of back up here and explain to me, what are we talking about when we say variants or mutants?
Well, the variants have developed in the past few months, really since last December. We started out talking about the UK variants. They have developed because of mutations in the virus in different parts of the world. And so we have been calling them in the popular press by their origin point. So the scientific term for the one that developed in the UK is B117. That one has a mutation, which we call the N501Y, also called the Nelly mutation. And the effect of this mutation is that it's associated with increased transmission of the virus. So the first one there, B117, first found in the United Kingdom. So it has an N501Y mutation, a change in the genetic material. And it's convenient sometimes to call this Nelly, N501Y. Starts with an N, ends with a Y. And this is associated with increased transmission. So in places where this virus is introduced, it tends to become dominant because it spreads more readily. The other ones, there are three that we were talking about that are found in Hawaii. And the South African variant has the technical name B1351. And it has the Nelly mutation associated with increased transmission. And another one that we're concerned about, E484K, also called the Eek mutation. And this mutation renders the virus less effectively neutralized by the antibodies that we make. So when a person is vaccinated or they're infected with SARS-CoV-2, or if they get COVID, they're going to develop antibodies. And the antibodies are not going to work quite as well against this B1351 variant, the South African variant. Now, the good news is, even though the antibodies are less effective, people who have been vaccinated or previously infected, they are still not going to get seriously ill. So you don't have to be concerned that the vaccine is not going to protect you because of these variants. Get vaccinated anyway. You may get a mild case, but the vaccine prevents serious illness and you won't go to the hospital. The third one on the list, B1429, also called the California variant because it originated there. It has a kind of mysterious mutation, the L452R. It's not as clearly understood as the Nelly or Eek mutations, but it's associated with increased transmission, just like the UK strain. And also, antibodies are slightly less effective against this variant. So those are the variants we've got here in Hawaii, and those are the reasons that we're concerned about them. Increased transmission, and the antibodies are slightly less effective.
Now, when you say that antibodies are slightly less effective, that's somewhat concerning to anyone who is thinking about or has already received a COVID-19 vaccine. When you say, and referring to the South African variant or the California variant, that it appears that the antibodies are slightly less effective, does that mean the vaccine is less effective?
Well, as I mentioned, the vaccine will prevent you from getting serious disease or from going to the hospital. But it may be, we still need to develop more information about this. People who are infected with one of these strains may get a mild or asymptomatic illness. And so it may not prevent infection quite as effectively as it would protect against the original strains that were used in making the vaccine.
All right. The other characteristic on there that bothers us, one is the fact that the antibodies are less effective, but the other one is this increased transmission. And how prevalent then with this increased transmission have these different variants become on the different islands around Hawaii?
Okay, well, I have some specific information on that, the latest information. So if you look for the entire state, most of the virus that's going around now is a variant. And if you take a look at the entire state, 59% of the virus that we found in the month of March in a random testing is the California variant. This has become dominant in our state. We have less of the B117 UK variant, but that's present too. And we have a very small percentage of the South African variant. So it varies by county. In Honolulu, on Oahu, the prevalence of the California variant is similar to what it is statewide, 59%. And the figures are very similar to the statewide figures. On Maui, you can see that the California variant is even more dominant. 82% of the virus in Maui is this California variant. And I think that's probably the explanation why the case rates are high in Maui. And they've had a lot more sick people with COVID in Maui in recent weeks. Okay, in Hawaii County, they have not as many cases, and the California variant and the UK variant seem to be similar in numbers. If it follows the pattern that we've seen in Honolulu County and Maui, I think we can expect that there may be more and more California variant over time. And I also will mention that Kauai is not listed here. And the reason is that there is so little community spread in Kauai that we don't have any data on the prevalence of the variants there. We may develop that information if these variants become prevalent and increase the case rate. But so far, at this moment, not enough community spread to say what variants are associated with it.
Early on, when we started talking about variants, people elsewhere, I think, first identified the UK variant, and then they identified the South African variant. And we were pretty careful in Hawaii to not use those locators, but to call the UK variant the B117 or the South African the B1351. But we now use those locations to identify them because that's the way people understand it. But we were trying to be careful because we didn't want to pigeonhole and kind of blame anyone in the UK or South Africa or anywhere else for these variants, because they can happen anywhere where there is transmission.
That's right. And actually here in the laboratory and in the health department, we call these by their technical names, B117, B1429, and so forth. I have a little story to tell about that. 100 years ago, there was a big flu pandemic, worldwide pandemic of flu, killed many people. And widely, this has been called the Spanish flu. And so the French called it the Spanish flu because it came to France from Spain, apparently. But it's pretty clear now, 100 years later, that we've done some molecular epidemiology that this strain actually originated in Kansas. So the blame was improperly placed. And actually, I want to emphasize your point that there's really no blame. Every country where this has occurred is a victim of this virus. And so no country should be blamed for the occurrence of the virus or a new infectious disease.
They're all frightening, but there's something on the horizon that I'm just now beginning to hear about. Fortunately, not here in Hawaii yet from what you're telling me, because you've identified these 3 variants as the ones that are here. But there's something that's reached the west coast of the United States that is a double variant.
That's right. This new strain has been first found in India in the region of Mumbai, and it has 2 of the mutations of concern. So we talked about the Eek mutation. It's got that one, or something very similar to it, called E484Q, similar to E484K. And it's also got that mutation that's present in the California variant, the L452R. So those are both mutations that are associated with antibodies less effective. So the concern is that this double mutant with two mutations that cause antibodies to be less effective, it might be less responsive to the antibodies that result from vaccination or infection. We don't know yet. This strain is brand new and hasn't been studied. But I guess the ominous news is shortly after it was reported in India, it was also reported in California. And I guess we've seen that what happens in California comes fairly quickly here, like the California variant, B1429 has come here. So this is something we're going to keep an eye on. We're not worrying ourselves seriously about it yet, but we have a program at the state laboratory where we regularly do collection of specimens from the community, and we do whole genome sequencing so we can detect and identify these variants. And we are definitely looking for this one to see if it comes here. And we're going to watch to see if any laboratory elsewhere in the world has ability to assess the effect of this double mutant strain and see if it indeed is more ominous than the ones we know about now.
Well, we really want to do the best we can protecting ourselves and our families and the entire community by, masking up and wearing these whenever we're out in public and continuing to practice physical distancing, because the more the variants spread, the higher percentage of the population we might have to vaccinate to achieve herd immunity. Is that right?
That's right. What we really want to do between vaccination and our community mitigation measures that you just described, wearing the mask, washing the hands, physical distancing, and no partying. We can't go to big parties, I'm afraid not. Those measures will reduce the spread of the virus. The more the virus spreads around, the more opportunities there are for mutations to develop. So we want to get ahead of this. We want to control the virus, reduce the opportunity for new mutations to develop.
Wow. Sobering stuff. We very much appreciate you taking the time to tell us about this. I think, we can get lost in the numbers and in the names and the B117s and, and the 1429s and all of that. But if there's anything to remember, it's to continue to do what we have done until we get more people vaccinated. And that's this right here, right? I mean, because we can protect ourselves. These variants, if we do the right thing, we can still protect ourselves.
Thank you for the opportunity to make that point. Very important point.
Dr. Desmond, thank you very much. We will continue to rely on you and Razvan and the other folks at the lab. I know you guys, I kind of considered you our gatekeepers at some point, because you are strategically taking samples and doing that genomic sequencing and looking for new strains that may come to the islands. And now you're tracking them. Unfortunately, you're left with tracking them within the islands and seeing how prevalent they are. And what you're telling us is that they're here and they're spreading. And people, please be good. I'd love to keep that double mutant out of Hawaii.
Thank you, Brooks.
Okay. Dr. Ed Desmond, the administrator of the State Laboratories Division. One more thing, folks, before we say goodbye, and that is to give you an update on just how many doses of the vaccine that we will expect next week. Unfortunately, the doses coming in to the state of Hawaii through the Department of Health will not be as robust next week. This week, we got 90,080 doses of COVID-19 vaccine into Hawaii, including 21,300 Johnson & Johnson doses. Well, next week, our allotment to the state of Hawaii through the Department of Health is going to drop to 76,060. That's 76060 doses coming into Hawaii. And a big reason is we're not getting a whole lot of J&J. The Johnson & Johnson this week is going to, next week, it's going to drop from more than 21,000 doses of J&J this week to just 2,600 doses of Johnson & Johnson next week. So we hope this is a temporary interruption, but we know that we're going to get fewer doses next week. And this is just as we are expanding vaccine eligibility. So if you're eligible now, that's your cue, folks. Go to hawaiicovid19.com and please take advantage of the opportunity to get yourself vaccinated, because as we expand eligibility, it's more people who are trying to fill those very precious vaccination appointment slots. So good luck with that. Thank you, Hawaii, for being so good. We talk about the scary variants and we implore you to please wear your masks. But truth be told, most people are really doing a great job. And if we keep that up, we're all going to get through this together. So thanks so much for your patience. Thanks for your interest in hearing Dr. Desmond talk about the variants. And next time I see you out and about, I hope you're wearing one of these, because I can promise you I will be. That's for sure. Have a good one, everybody, and we'll see you next week here on the Weekly Dose. Aloha.